My name is Dr. Soobhug Rishikesh Singh. I am specialized in obstetrics and gynecology. Currently, I am working at Jawaharlal Nehru Hospital at Rosebell. I live in QP, which is in the center of the island. In fact, before my promotion as a specialist, I was working as a general practitioner. And one day I was going to sign the attendance book and I found the advertisement from Merck Foundation. And it comprised of 5 specialties, one of which interested me was sexual and reproductive medicine. And as I had already done my specialization, but we have only a basic course of infertility, it was an opportunity for me to apply for sexual and reproductive medicine. Yeah. The few challenges, especially for the patient, because nowadays we are having the fertility rate itself in Mauritius has decreased, and this trend has also been observed around the whole world, most of which is related to obesity, environmental pollutants, use of pesticides in vegetables, and sedentary lifestyle, obesity, smoking, alcohol consumption, or illicit drug usage. So all these factors have contributed to a decrease in fertility rate. Nowadays, fertility rate in Mauritius is 1.4 live birth per woman. And usually when I am doing my clinics at the hospital, or even after working hours, we do see patients privately. I am having many patients who are coming with infertility problem, and most of these patients they are very stressed, very anxious, because they have been married for so long, or not able to conceive, and even they are having pressure from the in-laws, pressure from the society. So basically they want at least to have one child, and it is our utmost duty to help these ladies, these couples. First of all, we have to bring a fertility awareness program, which will sensitize the population about fertility and infertility itself. Because our population, it's an aging population, and we have our youngsters, which are the upcoming citizens of Mauritius, and we observe that many of them, even at young age, they are obese, they are developing diabetes or hypertension, which we are an island which is prone for this non-communicable disease. So I think we should sensitize firstly this group of population. Secondly, once the patient has come, we should do a pre-assessment program for these patients, so that in the long run we can at least have them to conceive. Definitely, the Ministry of Health and Wellness, previously we, at the government service, we were lacking a fertility clinic. Nowadays, on the 8th of March, the minister announced that in the north of the island, at the SSRNH hospital, there has been inauguration of a fertility clinic. And the plan of the ministry is to extend this program to the other 4 regional hospitals. And previously we only had a private fertility clinic located at Floreal, or most patients, they were going abroad to India to have fertility treatment. With the implementation of a fertility clinic in our regional hospitals, I see it as an opportunity to work in this clinic for the benefit of the patients and benefit of couples, because we really want to increase the live birth rate in Mauritius, because tomorrow we will be in the old age group, so we have to have youngsters to bring the country, to work for the country. When I joined the sexual and reproductive medicine program, there was no fertility clinic, but nowadays we already have one fertility clinic, and before this clinic was operational, Merck Foundation already offered us the opportunity to have a sexual and reproductive medicine postgraduate diploma. Definitely, I am my deepest and heartful gratitude to Merck Foundation and the Ministry of Health for having given me this opportunity to deepen my knowledge, to have access to all the new and recent clinical guidelines, access to modern medicine that is being practiced abroad, and this opportunity will allow me to bring all my knowledge, my capacity, my know-how for the benefit of the island.